Hello everyone, it's so nice to have this lesson with you all. Today we'll talk about a common respiratory disease, lung abscess. So a brief introduction of myself. I'm Wei Wang, a physician of respiratory and critical care medicine, the first hospital of China Medical University. What's lung abscess? Let's get an outline of this disease. First is the definition of lung abscess. It is a necrosis of the pulmonary tissue and formation of cavities caused by various microbe infection. So from this definition, we could know that this disease is a necrosis. Second, it can be caused by various infection. So it's also an infectious disease. Third, it has cavity formation. So these three parts formatted the definition of lung abscess. The clinical feature of lung abscess, including high fever, cough, purulent sputum with horrible smell. These are typical manifestations of lung abscess. From X-ray, we could see a pus-filled cavity in the lung surrounded by inflamed tissue. With the cavity, an air fluid plane could be seen. This is very typical for lung abscess in X-ray. This is the real lung abscess. We could see here, in the middle of this lung, there is necrosis, and the damage of lung structure, also the function. In the right part, we could see the X-ray of typical lung abscess. Here, this is a cavity we could see very clear. And inside this cavity, there is air liquid plane. This is very typical for lung abscess. We could see this. Lung abscess can be classified by 3 steps by infection pathways. First step is aspiration abscess. From the name, you could see that this abscess can be caused by aspiration from oropharyngeal pathogens or gastric secretion. The second type is secondary lung abscess. In this condition, there is always usually with pre-existent conditions such as obstruction, pneumonia, bronchiectasis. Sometimes this kind of abscess can be spread from an extra pulmonary site, such as liver abscess, because you know that the liver is near the lung, so liver abscess could spread to the lung. The third type is hematogenous lung abscess. In this condition, the patients usually have cutaneous abscess, or furuncle and carbuncle, or endocarditis, septic emboli. These kind of conditions can cause hematogenous lung abscess. So this section will talk about pathogen and etiology of lung abscess. The pathogens for lung abscess including many microbes, such as anaerobic bacteria. For example, bacteroids. It can cause lung abscess. The second, macroaerophilic streptococcus is very common for lung abscess. Aerobic bacteria, such as staphylococcus, can cause lung abscess too. Fungi, such as Candida, Aspergillus, can also induce lung abscess. Parasite is also common, such as amoeba. Parasite is very common for lung abscess in the past time, but now it's seldom be seen for lung abscess. So the etiology of these 3 types of lung abscess we could discuss in detail. First is aspiration abscess. This kind of abscess usually caused by bacteria in mouth or throat, and which are aspirated into the lung. Also, gum disease could also cause aspiration abscess. For the patient with unconsciousness because of sedation, anesthesia, alcohol or drug abuse, or a disease of the nervous system such as seizure, could also have aspiration abscess too. And gastric secretions, GERD. So this disease are also preconditions for aspiration abscess. If the patients have poor function of immune system, such as diabetes, they also are easy to get aspiration abscess. For this kind of abscess, the predilection site is right lung. The second type is secondary abscess. In this kind of abscess, there is usually with pre-existing condition such as obstruction, pneumonia, tuberculosis, cyst, bronchiectasis, also spread from an extrapulmonary or adjacent site such as liver, subphrenic. The infection of these parts could spread from here to the lung. Entamoeba of the liver is also a cause of secondary abscess. The third type, hematogenous abscess. In this type, the patients usually have infected blood clots traveling through bloodstream, such from the cutaneous abscess, furuncle and carbuncle, tricuspid endocarditis, or septic emboli. For this kind of abscess, the location usually be multiple bilateral peripheral distribution. The organism of this abscess usually be Staphylococcus aureus. So these are the pathogen and etiology of lung abscess. All of these are the dissection. So this is the old knowledge of this section. We'll continue later.